During this video, we'll explain what's involved in a posterior lumbar decompression or lumbar laminectomy, which may require a posterolateral fusion. Here, you can see the lower part of the spine with the muscles, tissues, and other organs removed. In the normal spine, the bones or vertebra move because there is a jelly-like disc in between them. Over time, it can wear down. Wear and tear also affects the joints at the back of the spine. As this worsens, bone spurs form which pinch the spinal nerves. Left untreated, this usually gets worse over time and can cause temporary or sometimes permanent damage. It can cause pain in the legs, buttocks, and back. It can also affect the feeling and movement in your feet, legs, and genitals. In some cases, there may also be a slip or step between the bones of the spine. Occasionally, your surgeon may be concerned about the risk of this happening if a simple decompression is done without fusion. You're watching this video because a surgeon has recommended you have a posterior lumbar decompression, which may require a fusion. This means unpinching the nerves and joining the bones. After being put to sleep, you'll be placed down on a special soft mattress. X-rays are used to guide the surgeon. An incision or cut is made in the skin of your back. The length varies depending on your personal requirements. The muscles and tissues are parted to reveal the bones of the spine. An X-ray is taken to make sure the correct spinal level is found. A small opening in the bone is made to reach the spinal nerves. This may be done at one or more levels in the spine. Various tools can be used to achieve this. The surgeon then ensures the sac containing the spinal nerves and spinal fluid is decompressed or unpinched. They will clear thickened ligaments and bone spurs to free up the nerves. The spinal nerves will then have a chance to recover. The pain may improve immediately, but it might take weeks or even months for your symptoms to improve. Some symptoms of nerve damage may not get better at all. If possible, the step or slip in the spine may be corrected. Often, this is not possible and the bones are joined as they are. Next, the surface of the bone is roughened to encourage the bones to fuse or join together. The bone that was previously removed, or a synthetic replacement, is then used to bridge the vertebra. Screws and rods are inserted to form an internal scaffold which supports and adds strength to your spine. To finish, the skin will be closed with stitches or skin staples. Over the next 1 to 2 years, the bony bridge becomes solid, and the spinal bones will fuse to become one. The purpose of this procedure is to reduce pain and improve mobility. We cannot guarantee that this will happen, but for most people that have this operation, there is some improvement. Out of every 100 patients, between 1 and 5 suffer from a minor or treatable complication from spinal surgery. These risks or complications may include wound infection. This is when bugs get into the wound and affect the healing. You may need antibiotics to treat it. Rarely, an operation is required if the antibiotics don't work. Bleeding or bruising, which usually resolves on its own over a few weeks. Rarely, if the bleeding does not stop on its own, you may need another operation to fix it. CSF or spinal fluid leak, which requires you to stay in hospital slightly longer to ensure it heals up. Sometimes, a further operation is required to fix this if it doesn't heal on its own. Some suffer an injury to a spinal nerve. If this happens, some patients suffer from increased leg, arm, or back pain. Some may have altered feelings on their skin or even a numb patch. This is often temporary, but it may, unfortunately, be permanent. Some people may form a scar around a spinal nerve. Over time, this can cause pain or discomfort, which may be similar or rarely worse than the pain before surgery. Even with surgery that goes according to plan, your symptoms may continue. In some cases, they may improve and then return again. The purpose of the surgery is to improve pain and mobility, but in some people it doesn't work or doesn't last. Most spinal operations require you to be face down to reach the spine. Parts of your body may feel pressure that they're not used to. This can cause soreness or even abnormal feelings in your body afterwards. This is usually temporary. In some cases, the bones fail to fuse or join together, or the metal implants may loosen or move. If either of these happen, you may need further surgery. Serious or life-changing complications occur in less than 1 or 2 in 1,000 patients. These may include one of the following: damage to spinal nerves, which can temporarily or even permanently affect your ability to walk, control your bladder, or control your bowels. It could even affect the feeling around your genitals and your sexual function. If this happens, you may require a period of rehabilitation. It may affect your ability to work and live your life fully. There's also a very rare risk of complete paralysis, which is nothing working from the waist down. If a major blood vessel is injured, this can cause injury to the legs. It may require immediate surgery to try and fix this. Most spinal operations require you to be face down to reach the spine. There may be pressure on your face and eyes. Rarely, this can cause injury to the eyes, which can affect your eyesight permanently. Some people cannot tolerate an anesthetic safely. They may have had a bad reaction to the drugs or develop complications from surgery. This may include blood clots in the legs and lungs, or stress on your heart, lungs, and kidneys. If you've had a bad reaction to an anesthetic in the past, please make sure to inform your medical team. If one of these uncommon risks turns into a complication, extra procedures may be required, such as a blood transfusion or further surgery. If any of these serious complications occur and they cannot be treated, there is an extremely small risk of not surviving the procedure at all. Thankfully, for most patients, there'll be no complications. You'll be encouraged to mobilize as soon after the procedure as you can. Most patients go home within a day or two. You'll be encouraged to do some walking and gentle exercise, which should build up over the next few weeks and months. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you have understood everything.